Hi everyone, welcome to the Majlis. My name is Yasmin Khwatir, and with me today I have Dr. Reem Bunyan. Dr. Reem, thank you so much for being here today.
Delighted to be with you, Yasmin.
Dr. Reem Bunyan is the CEO for the Center for Value in Health in Saudi Arabia, which leads the national efforts to enhance healthcare value. She has co-chaired the G20 Health Working Group in 2020, advocating for a global innovation hub, and she has received the King Abdulaziz Order of Merit for all of her contributions to healthcare in the kingdom and globally. And to begin with, Dr. Reem, I would love to ask you, what do you mean by value-based healthcare?
Thank you for starting with that question, because value is a new concept in how health systems are designed globally. And it basically means realizing the best possible outcomes, not any outcomes, but outcomes that matter the most to people in relation to how and what we invest to realize them, what resources we put in, whether it's our time or other resources, medications, beds, or otherwise. This new concept is a concept that health systems are moving into to address the big challenges that health and care are facing globally.
Mm-hmm. And this is also part of Saudi Arabia's Vision 2030, the plan to diversify the kingdom away from oil, but also uplift the lives of all citizens. So how does value-based healthcare fit into that plan?
Value is a central topic in how we're transforming our health sector and fitting in with Vision 2030 in realizing a vibrant society. Of course, we need to really focus on improving people's health and improving healthcare. I think that is a fundamental shift in how our Vision 2030 is moving our health sector, in shifting from the focus of, of course, we need to improve healthcare. We need to improve how healthcare provision is done in facilities or non-facilities, but improving people's health is a cornerstone. And to realize that, we're designing a sector that is value-based and focused on the person in our country.
And to take a step back, this is the new approach we're taking, right? What does healthcare look like currently? What is the traditional approach?
Healthcare is one of the really, if not the most complex sectors that we have. Complex because it really touches everything in a person's life. We oftentimes, when we talk about health, we think about a hospital or a clinic. Mm-hmm. And oftentimes we think that, the Ministry of Health is responsible for all the health outcomes of individuals. But when we, zoom out and think of it, the majority of what a person's health is a result of is outside of healthcare. Mm-hmm. It's what we call determinants of health. They're broad. They relate to education. They relate to environment, society, habits. Everything we can think of contributes to nearly 80% of health and health outcomes. About 20%, if not less, is attributable to health systems. Mm-hmm. And oftentimes, health systems focus on what is happening inside the hospital, inside the clinic, focusing on medications or procedures or surgeries. Classically, we measure performance of health systems by things that are done. Number of admissions, number of clinic visits, and that is something that is done globally. Process, what we consider process. And classically, any improvement to address challenges has been to improve that process, improve efficiency, increase throughput, talk about how better to utilize the most expensive elements in a facility like operating room or emergency room or critical care units. But with with the challenges that are facing health systems everywhere, and I want to focus on a couple of things, a couple of really big challenges that we're facing. One relates to the rapid pace of discovery and innovation in this field, whether it's new conditions, like we experienced COVID, a whole new condition that requires attention, resources, guidelines, treatments, diagnostics, everything you can think of, down to everything else in the field of health, gene therapy, advanced therapies for cancer. My own field, in the field of MS, we now have what I call a buffet of options for therapy. So that is one big challenge that health systems are facing. The other challenge relates to people getting older, and that is, more important for us in Saudi Arabia and the Gulf region, because we are a young population. Majority of our population is less than 50 years. And within a few years, we will have a very big change in our demographic, where people are going to be older than 50, older than 60. And, that is one of our vision's objectives, is to have people live longer. Mm-hmm. And to address those challenges, we really need to have a major shift, a paradigm shift, to focus on improving people's health, focusing on any intervention that we can do to improve a person's health. And if at all that person is going to get sick, we would like to detect that illness early and give the right treatment to the right person at the right time.
And what are the challenges you may face or you face currently as you try to enact this change? Because you've been working on this since, pre-2020, but 2020 being when you co-chaired the G20 Working Group.
Well, this movement is a paradigm shift, and it's complex. And in health, it's not something where you can realize the results very quickly, because if we talk about prolonging a person's life, it takes a lifetime to realize that. Therefore, the change really needs to happen at two levels. One level is from the top, which has to do with the policies that need to be in place, the structures that need to change, the way we measure, value or performance of a health system. The other side of it is at the level of the front line, where the clinician meets the patient or the beneficiary. I always say that's where the magic happens, because that is really where value is created. When someone comes with a symptom or a condition to meet a healthcare provider, usually that interaction is where value is created, and that there needs to be a change in that dynamic. First of all, the role of the person that's receiving care needs to be activated, and that requires health education, requires also the healthcare provider to bring them up to a level so that they can agree on what the desired outcome would be of this care plan, whether it's something like diabetes or whether it's cancer, whether it's MS or any other condition. And then the clinician also needs to really focus on that, because oftentimes as clinicians, we're eager to do more tests or more scans, or and sometimes we do more consultations or hospital admission or things like that, because the general feeling of the clinician is that they want to do more. They feel like that is something that would yield a better outcome. But that is not the case. And so the change in this dynamic between the clinician and the patient requires a lot of change. And that change is challenging. It needs time, and it needs to spread everywhere in the ecosystem.
So what you're talking about is, somewhat policy related, but there's also, I think, that intimate relationship between the clinician and the patient that requires change, but isn't necessarily something that can be taken from top down. How does that look?
Exactly. It looks like a range of things that need to happen. Improving people's health literacy. And that starts in schools when people are kids, understanding, good habits, behaviors that they need to take to be healthy. Also improving their awareness, especially of common conditions, improving their awareness of their role when it comes to health and care, whether it's in a, serious illness or otherwise, but also requires a change in how the practitioner does it. And so we're talking about including awareness and capabilities in nursing schools, medical schools, other healthcare professional schools, and residency training programs and otherwise. So it's a huge effort that needs to come into place.
And we can look at these as challenges, but we can also look at them as opportunities for growth in the medical field. So how can we look at it that way? What does that look like?
Oh, huge positive way to look at it, because they're, especially in our part of the world, especially in Saudi Arabia, where people are very tech savvy and they're digitally literate, they're more ready to adopt and use technologies. And I think that's a huge opportunity. We've experienced that. We've seen it, really come rapidly during COVID. People's readiness to engage with apps and use those as a means of reaching or engaging or learning, but also a way for us in the health sector to learn more about our population, how they engage, their conditions. And then as we go forward, artificial intelligence is going to help us either provide services or measure them or engage or develop new tools for measuring outcomes.
And what does the role of the public sector look like here? Because it seems like this approach is not one that is necessarily driven by profit, nor should it be. So it's not something that you want to rely on only the private sector to enable.
Correct. So maybe I'll say something about our health sector and what it looks like. Our health sector is, if I'm going to simplify this, divided into like three parts. There's the public sector, which is the transforming Ministry of Health, moving into the health holding company as the provider, which is about 60%. And so now the new health holding company is the largest provider in the company and in the country. The second is other government sector. We have military, National Guard, security forces, university hospitals. They are also public providers. And then their private sector. The private sector is privately funded by the private insurers, but the public sector is publicly funded. And there is a new entity, which is the Center for National Health Insurance, which is existing to fund care for populations. And that is a new approach. It's an innovative way of approaching the health system. And it's a very complex, the national transformation that we have is a unique story globally, very complex, involves a lot of parts, and it really is very ambitious. One of the reasons we created our national think tank.
Could you tell us a bit about that? I think the history and the context is very useful because you've been a practitioner for a lot longer than Vision 2030 was announced. So how has that transformation looked? And you have your own personal role in it.
Yeah. Well, I'll start with my personal story to ease us into this. So I've been involved in the national transformation story now since the end of 2016. As one of the national leads in designing the new model of care. And it's been really an enormous experience and unique, and I'm so glad to be part of this story. The beginning of it was designing the new models of care, which are the core of what we're trying to do is to redesign around the people and the individual and the family and the whole of community or whole of society. And then the other parts of the health sector, as I described, emerged. In January 2025, our think tank turns 5. And the think tank on value in health was created as an entity that focuses on this new and complex topic of value in health and care to help share knowledge, advise on policy, build capability in this field, and focus on measuring and reading back to the ecosystem what value is being delivered and how far we were making progress.
And over, you've been involved with the vision for the past 10 years, with the center for the past 5 years. What has been the evolution like? What has success looked like to you?
A lot is happening. I mean, and it's been an extremely interesting story of the various levels of adoption of different elements of the effort nationally. We spoke about the different elements in our ecosystem. It's been very interesting to see how the private payers and the private providers have gotten very engaged, particularly in measuring patient experience, patient-reported outcomes. They've accelerated more than we would have imagined. There is a huge interest in the new generation of practitioners in being engaged in this movement, but it's a marathon.
Of course. And when you look at the field of healthcare in Saudi, in 2005 and 2015, now going into 2025, what have been some of the key changes you've noted? If we zoom out and look at healthcare as a whole.
Major policy decisions to form and reorganize what the sector looks like. And those are major decisions that were made, and the early stages of operationalizing these elements are in place. The other part relates to our population. Our population is changing. They're more engaged in their own health. They're enabled by some of the efforts that are part of Vision 2030 and the Quality of Life program that is encouraging people to move, activities, sports. The Ministry of Sports is doing quite a bit of work in that area. And so the movement is happening. And, whoever's been to Saudi Arabia several years ago and comes to visit now can very clearly see the difference.
And in order to be able to complete this marathon, as you call it, we'll need the support of, key stakeholders. There needs to be political will involved. So how do we reach that finish line?
I think we are in a very lucky and good place in terms of the political commitment, and we are, in fact, a role model for the world. Some of the work that we're doing at the Global Innovation Hub is advocating for this movement, sharing knowledge across from different health systems. We're working with a number of the members of the Global Innovation Hub that are very keen to share experiences on their respective journeys to transform their sectors. And I think that is really a unique place that we're in the world.
It's, as a Saudi, it makes me proud to hear this. And not only in healthcare, I suppose you're having this impact in healthcare, but this has a broader impact on many different sectors. So could you describe to me, what is the benefit of value-based healthcare for someone in a different sector, say education or labor, etc.?
Definitely a clear and direct impact. When people are healthier, they are more functional in the community. I mean, they can work more productive, work for longer years. They can raise families in a more complete and holistic way. The impact on the society at large is huge. And on the economy, of course, because we always talk about how value is the combination or the optimization of outcomes in relation to resources. And so we speak about resources, including a person's lost or gained days at work or at school, or utilizing other resources like transport. We speak a lot about the impact of value on the climate challenge. Utilizing resources that are unnecessary would be a negative impact.
I see. And in order for this change to occur, there also has to be capability building and an influx of human capital or a growth of human capital in Saudi. What is your outlook on that?
Capability building for realizing high value and the goals of the transformation of the health sector are at one level in relation to the healthcare providers. At another level, it relates to capabilities when it comes to measuring, coding. I mean, there's huge efforts in coding, costing, understanding how much the care provided costs us in order to be able to fund and measure and manage. So those are new capabilities that are existing, but maybe not in the right amount that we need. Digital capabilities, I would be amiss not to emphasize the importance of digital. As we say, it's the backbone of 21st century health, whether it's in being an extension for the humans or in enabling us to measure the activities and be able to understand how much we're doing or how far we're going. And that capability and that infrastructure is being created at the moment. In fact, we have a platform that's called Nafis, which is a unified information exchange, which is going to provide everyone in the ecosystem information about an individual that, for example, goes from city to city or element of a health sector to another element, understanding like what drugs they're on or tests they've had. I think that is a very important element.
And I would be remiss not to say that, Saudi's digital infrastructure, particularly in healthcare, is quite impressive. And a lot of that actually came out of COVID when, things had to become digital. So I had Her Highness Dr. Ahad Sarood on a few weeks ago, and she was in fact saying COVID was a great thing to happen to the healthcare sector in Saudi because we were able to advance so much in terms of the digital infrastructure. And I'm wondering if there's other areas in healthcare in Saudi that you think are worth pointing out as meaningfully different from the global landscape, whether that's something that's unique to the culture here or something that we're excelling at in terms of the global benchmark.
Well, with regards to the model that we are moving towards now is unique because it's a whole of system movement. I don't think any other sector or any other country is doing it in a whole of system way. We're changing everything. We're changing how we're providing care. We're changing how we're funding health and care. We're changing the form of the regulator, and the Ministry of Health is turning into a futuristic super regulator. So that approach in itself is unique. The digitization that we were just speaking about is unique globally. We have an example that, was spoken about last week with the release of the budget for 2025, the Sahha Virtual Hospital. It's a unique hospital that is a model for the globe, where it's a facility that has no beds, but provides care for people in different disciplines, outpatients, inpatients, and it's improving equity in terms of reach of care. It's improving utilization of talents in highly specialized disciplines. So that's another example where we're unique.
What does the future of healthcare look like now that we're talking about, a hospital with no beds, for example, and as we're adapting to people being able to take better care of themselves, people being able to use telehealth when issues aren't that serious. What do you think are the major changes we see coming to the way we do healthcare?
I think one major thing that's going to be happening is enabling the individual to easily navigate all their needs, to easily understand what they need to do in order to be healthy, easily access care in the right place, in the right time, whether it's, via video call or home care or primary care, because there's a lot of emphasis on the importance of primary care as the foundation of what a health system does. And so that shift, I think, is going to be a very important shift that we will see in the future.
So empowering the individual is really the future of healthcare. Yeah. I think I agree with that. And I'm wondering also what role insurers will play in the future? Because I think there's also a lot of disruption happening in the insurance space, and maybe that's also become a bit outdated in what the future outlook looks like on that.
Most definitely. How we fund is changing. And I think that the new Center for National Health Insurance is a new entity that is going to be financing health and care for that centers around the population, rather than facilities or structures. And I think this new approach is a feature of a system that delivers value.
So how does that work exactly? How is that different from, regular public funding for healthcare?
Classically, funding it has been around facilities and structures. So it would be calculating the budget based on how many hospitals you have, or how many beds are in the hospital, and the nature of the beds. If they're critical care, they're more expensive than general beds. And so the more beds you have, the more funding you get. Mm-hmm. And the idea was to do that and to get the funding in bulk for that type of care provision. Therefore, the focus would be more on providing hospital care. The new approach is to fund for the population, and that would enable the provider to think about the best thing for the beneficiary. And we say beneficiary because we're assuming they're healthy. They're not necessarily patients. And so what the beneficiaries need sometimes is a wellness program. Mm-hmm. And that wellness program would be done in the community or in primary care, and enforcing and strengthening primary care, because that's the first station a person needs to go to for vaccination, for prevention programs, screening programs that are necessary for the individual. And therefore, that's where the funding would go. Mm-hmm. And then for hospital care, we would need to re-ask questions about any service that's being provided, and can it be provided at home? Can it be provided in another way? Is it absolutely needed? And then for the hospital then to be purely for people that actually need hospital care.
Got it. And I'm wondering, this sounds like an incredible model. What is Saudi's role then to amplify and to progress things on the global stage? Because traditionally we had Western models from the US and Europe be planted in, let's call them emerging markets like the Gulf, like South Asia. What does the future look like there?
In the global scene, we started in the beginning speaking a little bit about the G20. We had the opportunity to discuss this topic when Saudi Arabia was presidency in 2020. Of course, I say we've already been in school because we studied all health systems, and we understood that all health systems were facing similar challenges. And so we discussed improving value in health at the G20 table, where we were able to, one, validate that everyone is facing similar challenges and everyone is trying to move in the same direction. And we were able to establish the Global Innovation Hub for Improving Value in Health as a global think tank. Mm-hmm. And this entity exists to accelerate this movement that's happening globally, to advocate for this at the G20 table. And we firmly believe that sharing knowledge is a key to accelerating the movement. Mm-hmm. And whether it's examples of how health care is being provided, whether it's innovations in health systems on, providing care in a certain way, that's the core of what we do at the Global Innovation Hub.
And it's an admirable effort. When you have so many, global players at the table, there must be some issues faced in terms of who can get what done and what they can bring to the table. What has that international cooperation looked like?
It's been extremely interesting because the hub, the membership is voluntary. Mm-hmm. And we have 18 of the G20 members. The WHO is with us, the OECD, and the Islamic Development Bank. And this year, actually, in 2024, with the Brazilian presidency, we had the opportunity to discuss the progress of the work of the hub at the, in a plenary session. And it was very wonderful to be able to hear the countries contribute to the conversation, and how the language has evolved over the years, and how the ideas have evolved over what areas we could focus more on, what areas. One example is digital, which we were just speaking about, the importance of including that in our thinking, including that in our case studies. And I think the future is going in that direction.
And another trend we can talk about, one thing that's on people's minds is digital transformation. The other thing is ensuring a full capture rate when we think about people in more remote areas. And this is applicable to Saudi, but also to many other countries. What are the efforts in that field?
The topic of equity is really close to us. It's really close to, when we speak about value, we say the right care for the right individual at the right time. And the equity challenge is different in different settings. We always say that health is very local, actually national or subnational. And the challenges in equity are different from one sector to from one country to another country. In our case, we think, and of course this is a piece of work that we're working on. We think that the challenges are mainly where a person lives, in terms of ensuring that they get access to all the care services that they can. The Saha Virtual Hospital was one way of solving it. And the topic of equity was also discussed in the global scene. It's something that is often being mentioned, understanding the variation in health and care outcomes within a country or across nations. Understanding the reasons behind it is extremely important to solve for.
And globally, another trend that we're noticing is a declining birth rate in many countries, actually, including Saudi Arabia. I mean, it's not as dramatic of a drop as, say, Japan or Korea, but it's significantly less than what it used to be. How does that affect your outlook on healthcare?
Well, understanding the population is an extremely important starting point when you're planning for what you're doing. I mean, we're at the end of 24, so thinking about what we want to do for 25. And I think that exercise, that cyclical exercise of understanding the population, is an extremely important step. Understanding the population composition, the health needs that population would have, is an extremely important step. And that's why we always say that, the future is going to be different from the past. And we think that the population composition and distribution might change as we go forward.
Of course. And when you look at your achievements over, not just your personal achievements, but of the hub and the center of the past couple of years, I would love for you to reflect back on a moment or moments that have really stood out to you in terms of the transformation.
It's been a wonderful journey, and every day has been a great day when we, come and do some thinking and sharing, especially the advocacy piece, when we engage with our stakeholders, partners in the ecosystem, whether nationally or globally, is often a great and exciting moment for us. We recently had one of the global figures, Bob Kaplan from Harvard School of Business, visit. And we had a room full of some of the senior policymakers in our ecosystem. And there was a lot of excitement and also deep discussion. And to me, that is a special moment, because a few years ago, that was not the scene. It was a new topic. The interest wasn't there. It was considered more vague and conceptual. And I think that making that progress and impacting, people is always a great moment.
Of course. And I'm sure, coming up on your 5-year anniversary, you have the next 5 years in mind. So what are your hopes and ambitions as we race towards, Vision 2030, and how you hope for value-based health to advance in that time?
Thank you for asking me that question. We're speaking a lot about it nowadays. We're speaking about the new frontiers that we're going in, speaking about the areas that we need to focus on as a think tank, and the areas that we need to really the policy questions that we need to answer, that are the next policy questions for, as you say, racing towards 2030. We're thinking a lot about measuring value and how to do that, what metrics to use. And so that's an important part of our next 5 years. And we're approaching it with a lot of excitement and energy.
Well, wishing you the best of luck in your efforts so far and the efforts to continue. Thank you so much for what you're doing for the kingdom. It's been a pleasure to have you today.
Thank you for having me.